Expectation, excitement, those first sounds and first smiles. For many families around the world, pregnancy is a joy and pleasure, but for some, it looks much different. In northern Ghana, maternal and infant mortality rates are not numbers on a page, but solemn realities that steal mothers and babies every day. Every pregnancy brings fear.
Women were giving birth at home, and it was very difficult. The unlucky moms were dying during childbirth, or often the baby would be stillborn or die soon after birth. All mothers were suffering.
The truth is, in rural areas of Ghana, access to quality healthcare facilities or services is very limited. A mother with a complicated pregnancy must travel a distance which leaves her life and the life of her baby at risk.
Where our communities are is far away and the road is terrible that we cannot get access.
Further complicating pregnancies are cultural beliefs surrounding childbirth. These practices have created a resistance to modern medicine and prenatal or neonatal care that have greatly contributed to staggering mortality rates. In response, the Helmsley Charitable Trust partnered with Catholic Relief Services to develop the Rural Emergency Health Service and Transport, or REST program. As with every Helmsley program, our goal is to provide sustainable solutions, so a comprehensive program was developed, and we sought out and equipped community leaders to facilitate it. With the help of these leaders and role models like seasoned mothers, communities are seeing changes in how pregnancy, childbirth, and newborn care are viewed.
With REST, we have been able to support them, give more education for people to understand that all these things can be done without any harm. And so because of that, our pregnant women are now coming earlier to register for opening of their pregnancies.
And since women are now encouraged to deliver their child at a medical facility, transportation to and from these remote areas became paramount. To address it, we provided 50 rural ambulances in the form of modified motorbikes.
The innovation of the motor ambulance is able to help us go into the hinterlands where a car cannot get in.
Each rural ambulance has space for a laboring mother to lie down as she is driven to a hospital to deliver her baby under qualified caring hands. Now, a ride to a healthcare facility is a phone call away. And already more than 2,000 precious lives have been saved. Through extensive training in obstetric and newborn care to hundreds of midwives, nurses, bedside attendants, and local leaders, as well as improvements to local healthcare facilities, the standard of healthcare in the region is changing.
The greatest difference is that before the REST program came, pregnant women often died during childbirth and stillbirths were rampant. But since REST has arrived, all of that had been greatly minimized, if not eradicated.
Pregnancy is no longer a potential death sentence. Wives and sisters can live. Babies can grow up in their mother's arms. It's now possible for families in Ghana to experience the beauty, expectation, and excitement of pregnancy. Smiles on young and old are changing the face of Ghana, and we are honored to play a part in it.